Well, hello, Liberty listeners. Welcome to another episode of Liberty Road. Excited to have you guys here with us today to listen to Dr. Sonia Singla and the work that she's doing locally here in Los Angeles. But it's the kind of story you'll be inspired by, and the learnings about why she's transitioned will be available to you wherever you are. You don't have to be in Los Angeles to get her wisdom. Dr. Singla, thank you for being with us today.
Oh, thank you so much for having us. I'm so excited.
Absolutely. Let's first start with, what is Marigold, this new thing that you have launched?
Well, the Marigold Center opened in Pasadena, California, and it was created to be more than just a health clinic. It's a sanctuary, it's a movement. We are at this inflection point where women are getting the attention that they deserve for midlife care, but we haven't translated that into our actual health systems, right? So I wanted to create a place where you walk in and you felt calm, you felt empowered, you felt like you were going to be able to have these open conversations, because midlife is not a decline. I want to reshift the narrative to something that can be reimagined. I like to call our 40s to 60s our power decades, because they get us prepared for this wonderful next chapter of our lives, but we have to have our health optimized. And I don't know why that has to be done in a scary way that's not graceful, that's not beautiful, that's not community based, with honesty and integrity.
Yeah, well, we're so glad you're here doing that work and being an example for others who are trying to think about how we can tell those, or switch the narrative, I should say, while also caring for ourselves. Let's back up a little bit, because I want our audience to know that you're a doctor who's practiced, traditional family medicine for many, many years. I think 20 years. Is that right?
Yes,
Yeah.
I'm a family medicine doctor, and a clinical researcher. So I've spent, I'd say, more than 20 years doing that.
You shared with us the motivation behind wanting to start the Marigold Center in terms of finding a way for these various things to come together:
Mhm.
community, medicine, this calm space where women can ask the questions and get the answers that they need with regard to their midlife health, let's say. But what takes you from the work that you're doing to be like, I'm the person, I'm the one, and imagining what Marigold could be, when there really hasn't been a model to date that looks like what you were imagining? What gave you the chutzpah to kind of go for it?
Well, I think, all of it is our lived experiences, right? Which sort of,
Yeah.
this is the point where we arrive, right? We've got all of this wisdom and all of these experiences. And for me, that was being a physician in the hospital, seeing how fragmented care was for all people, but especially for women, right? Seeing how women had to do lots of different things to just get the basic care,
Yeah.
seeing how we treated the symptoms and not the whole root cause and the whole person. And for me, my midlife story is very personal, because I went into premature menopause at 39.
Mm.
I had a cascade of symptoms that I was ill prepared for. I went to go see a lot of well-meaning physicians for my chronic bronchitis, my new onset glaucoma, for my frozen shoulder, my plantar fasciitis, for my osteopenia at 39, which is decreased bone density.
Mm-hmm. Mm-hmm.
And I was sort of received with these answers like, okay, well, you have to be on steroids for the rest of your life for your bronchitis. Oh, we have to do surgery for your shoulder. And you must have, weak tendons. You got to do something or you're going to end up in a wheelchair. And, these physicians were my friends. And again, they are great doctors, but they just didn't have that sort of knowledge. And when I pushed back and I said, but the temporal relationship is such, is that as soon as I started menopause, all of these symptoms came like overnight, not to mention the brain fog, the night sweats, the hot flashes, but these were
Yeah.
debilitating, physical medical symptoms. And they just sort of shrugged and said, gave me a quizzical look like this has nothing to do with it. And so I actually, like most women, have to take charge of what they need to do. I wrote my own prescription for estrogen, for progesterone, because I
Wow.
couldn't get anyone to do that. So it sort of began my deep dive. I was 10 to 15 years younger than most of my friends who had
Yeah.
they were even close to menopause. They were still having babies. And so I felt better, starting myself on hormone replacement therapy, but I didn't feel whole. I didn't feel like the way I did in my 30s. And so I started down this path of Ayurveda, and it's an Eastern Indian medicine, much like Chinese medicine. And I realized that we needed, holistic care. We needed to sort of be in touch with ourselves. And it really changed the direction of my life. I sort of had this idea to open up the Marigold Center. I had this vision of trying to make healthcare not only accessible, but easy for women, right? All we do is run around and take care of everyone else. We put ourselves last. And I wanted to sort of bring everything in house. So to say, like, here's your midlife strength coach, here's your nutritionist, right?
Yeah.
Here's the chair that's going to help you with your pelvic health. Here's the breath work, and here's the yoga, here's the meditation, here's the sound bath. It's all here for you, because I know how busy we are. Even the simple things, like for me, I just couldn't, for me to get my labs done fasting, to go out, get dressed without having my cup of coffee was really hard. I would
Yeah.
be
Yeah.
dizzy. I would be like, oh, forget it. I'll just do it next week. And I would push it off. So, I tried to take that off the table. I have a female phlebotomist that will go to your home and draw your labs for you. So you can just be in your pajamas, roll out of bed, get your labs drawn, and then have your cup of coffee and be on with your day. So I think for me, it was this feeling that women deserve more, that there is a better path. And I think perhaps my, Indian upbringing made that simpler for me because my grandmother lived with us. She had all of her herbal remedies with her foods and her
Sure.
cinnamon and her turmeric, right? And so I sort of was able to tap back into that and sort of use the best. My dad always had the saying, take the best and leave the rest. And I felt like in my entire life as, a proud American and as, a daughter of immigrant parents, that I was able to blend that. And I really wanted to do that for my patients and for my friends and for women sort of across the board.
Yeah, I love that the story is equal parts your own medical journey, and as a doctor, being able to kind of identify and address some of those things and say, well, wait a minute, well-meaning people aren't giving me the tools I need, but I know better. My education has gifted me the ability to make the changes I need for my own health, and also wait a minute, how can I do that for others? How can I take the thing that I need and offer it to other people in a holistic way, and then benefiting from not just the warmth and the hospitality of having somebody come into your own home and draw your labs, but also leaning into some of the other things that given your heritage and given what you saw through your grandmother. I mean, it's kind of this beautiful alchemy of all the things that your life was telling you, like, you have to do this. This has to materialize in what is now Marigold Center. And I think it's a lovely reminder for those of us listening, like, what are those things in our own lives that we can
Mm-hmm.
take and pull together to create whatever interesting and needed and of service outcomes that we can. So thanks for sharing that with us. I want to go back to this Ayurvedic sort of um, philosophy and practically speaking, like, help us to understand, those of us who are not familiar, what is it? What does it practically mean? And how are you incorporating it into the Marigold Center?
Mm-hmm. I love talking about Ayurveda because I used it to get myself better. And then I studied it so that I could be certified and bring it to women. And that was not, again, like you said, it wasn't my sort of intention.
Sure.
It was so powerful for me. And then the people that I talked to about it, that
Yeah.
I thought, oh, okay, maybe I could do something with it. I wasn't sure what I could do with it, but my certification sort of was the final prompt and catalyst to get the Marigold Center started. You know, tapping into ancient wisdom is
Hmm.
not new age, right? It's true healing. And my goal is to sort of bring it mainstream, to package it in a way, because people will say to me like, oh, well, you know, that's really sweet, Dr. Singla, that you're into, Ayurvedic
Yeah.
medicine, but I just want my regular, prescription medication. I'm like, that's fine. And I understand that. And we have to find that balance. But the truth is, it's not out there. It's not woo. Ayurveda means the science of life, right?
Mm.
So it's this whole body of knowledge of how to live that's thousands and thousands of years old and battle tested, right? And the thing that I love about it is that our outer environment like mirrors our inner biology, right? So if we tap into our instincts, and this is what I want women, we have so much gut instinct. We there's so much
Hmm.
about us that as women that we're like, we know when something's off, we know when something's right. But over the years, we have to let that go because we have to function in this world, right? We have to be professionals. We have to climb up the corporate
Right.
ladder. We have to, but we use it. We normally use it with our kids. And what I'm trying to tell women is let's use it for us now, right?
Mm.
Let's make sure that we tap in. This is the time to have a reconnection with ourselves. And in Ayurveda, this menopause midlife tradition transition is about getting in touch with yourself, having that deeper personal connection, slowing down. And so, things like the gut mind connection that has been around in Ayurveda since the beginning of time. We call that the fire in your belly. That's the digestion. We want to get that right and balanced so that the other parts of your body can function correctly, right? So I use it as a lens. I mean, quite honestly, I can have a patient walk in through my office and I can kind of tell, you have basically a predetermined constitution, and that's sort of based on your body type, the shape of your eyes, how your gut functions, and so those sort of three different constitutions are a blend of who we are. One is more dominant than the other. And so I can sort of see when a person walks in, oh, you know what? They might metabolize estrogen a little faster, or they may,
Wow.
honestly, they need to like cut down popcorn and all these snacks that are eating because it's drying them out. And right now, the midlife shift is we are sort of in that drier air space. It's called vata time of life. And so we need things that ground us, that nourish us, right? So I tell my patients, I want you to think about eating warm, moist foods to get that moisture back into our bodies to make us feel grounded again. Women will say, I have looping thoughts during, this perimenopause, menopause. It's because there's so much movement in our body because we're not grounded. We're drier, right? So think about the desert, right? You're just sort of dry. There's that air and movement. We want to get closer to water. We want to get closer to earth. And so all of these things, right? Sound bath, which is vibration healing. I am trying to bring people back into that parasympathetic state, right? As women, we have circadian rhythms. We're not meant to just be go, go, go all the time. Men have a different physiology. They have a different biology than us, right? Our hormones turn off at menopause. Men's they have them. They continue to decline, but they have them. A 65-year-old man has more estrogen than I do naturally. Um,
Wow. I had
and
no idea. Wow.
right. So if you think of perimenopause, your estrogen is sort of going like this. It's a roller coaster because your ovarian reserve is declining. So your brain, your LH and FSH are telling your ovaries, come on, we got to get these out. And so you're fluctuating, even though your estrogen is actually declining. Your progesterone, which is your calming anti-anxiety hormone, that's declining. Your testosterone is declining. And then at menopause, everything just shuts off, right? So if you look at health span, which is defined as healthy aging, right, which is what we all want,
Sure.
we start to see a huge decline after the age of 50 in health span in women. We live long. We just live with a lot of comorbidities, right?
Yeah.
Autoimmune, hyperlipidemia, hypercholesterolemia, diabetes, all of that. If you look at men and if you take out, high risk behavior, let's just say a healthy man, their lifespan could be up to 70 years old, right? So 10 to 20 years longer than ours. And, we haven't done a lot of research, but ostensibly, what's the difference, right? Our hormones turn off at menopause, theirs do not. And so estrogen is our powerhouse hormone, right? It's our anti-inflammatory, it's our elasticity, it's our moisturizer. It does so many things in our body. And now we know that we have estrogen receptors all over our body that we need. And so when we lose that, what are things that we can do to help supplement? Obviously, hormone replacement therapy if it's appropriate, microdosing GLP-1s, and then I offer the Ayurvedic side because we need all of it to make this midlife shift happen and thrive through it all. For me, it's all about inflammation, right? So when we talk about yoga, sound bath, meditation, that brings down inflammation, just like any kind of statin would or any other medication that we might be prescribed. So why don't we use the things that are easier than medication, that have less side effects and actually have an effect on our whole mind, body, spirit? So, for me, this is such an important piece because I want women to invest in themselves, to give themselves the time. I had a patient the other day who came in for sound bath in the evening. And, the next day she sent me her Aura Ring score, her sleep score, and she said, I got a 96. I have never gotten a 96. It's been 10 years since I've had a good night's sleep. And I had said to her, you are optimized, right? You're microdosing a GLP-1, you're on hormone replacement therapy, you're working out, you're eating your protein, you're doing all the things, but she has a lot of anxiety just in general. It's just her personality. And I'm like, we need to bring that down. That's the thing that's going to make all the difference in the world, right? And so these are things that we have to think about and we cannot ignore, or we won't be able to have those wonderful times in our lives that's waiting for us. I'm able to
Sure.
do what I'm doing today because I did all those things. I could have never
Sure.
opened the Marigold Center 10 years ago. I wasn't ready.
That's a lesson for all of us too. Like that timing sort of presents itself. We just have to be ready for it. I want to go back to a few different things that you've said, and thank you for laying that out for us. When you said we should, or you were suggesting to a woman that she should be eating warm foods. Did you say warm foods, wet
Warm,
foods that
warm,
warm
moist
it?
foods. Yeah.
Yeah. What are those? What are is that
Mhm,
like
mhm,
oatmeal and soup? What is that?
mhm. It's a lot of soups, right?
Yeah.
Um, in Ayurvedic, there's a perfect blend of, it's almost like kanji. It's rice, it's lentils, it's a little bit of vegetables with yogurt, and you
Yeah.
sort of mash it up, right? And it's so warm, and you feel so good. It's the Ayurvedic version of chicken noodle soup.
Yeah.
But yes, sort of all those foods that you think about that might give you, like I tell patients, eating a salad, fine. But raw vegetables are really hard to digest. There's that insoluble fiber versus soluble fiber, right? So cooked vegetables are just easier on our body. If you put out a broccoli and you leave it on the counter, a raw broccoli, it's fine. It just sort of stays there for a long time. If you put a piece of cooked broccoli out there, right, it decays quickly. So in our body, it's the same thing. We can digest, we can process cooked foods better than we can raw foods. If you are going to eat a raw salad, I always say, add a lot of olive oil, add a lot of balsamic vinegar, just to help get
Break it
that
down.
down and break it down and sort of coat the lining, if you will.
Okay, that's super helpful. And then I thought it was really fascinating that you said that people can walk into the clinic and you can tell by their composition. I think that was the word you used, but you addressed like their eyeballs and their body shape, and you can tell like what they need to reach or to get to that optimal place of health. That's fascinating to me. And I'm sure everybody, myself included, wants to run on down and get that diagnosis, if you will, from you. Um, how how have you learned that skill when you're somebody who has been medically trained? How have you learned to tap into something other than Western medicine? Because my guess is that was probably a little tricky.
Absolutely. And I think it was until my own failed health that
Mm,
I didn't give enough, credence to it. I think, when I was in medical school, I was like, all the things that
yeah,
I learned from
whatever.
my
Yeah,
mom. That's
yeah.
just what you do when you're young. And it took me a really long time to sort of look around and say, like, okay, this isn't working. We don't care about preventative care enough. We don't care about maintenance care about enough. We don't care about making sure we know some of the things that are going to happen in old age. We need to start now. Why aren't we starting now, right? And so being in the medical system and it's a quagmire, right? It is a really difficult thing to navigate. It doesn't matter if you're wealthy, it doesn't matter if you had great insurance. It's really tough.
Mm,
And I felt for the women who were struggling in every capacity, right? With every piece of their health. And I just felt that even the most well-meaning doctor has, 20 minutes to see you. You can't answer all of the questions that you have in 20 minutes. It's just not enough time. It's just the way the system is set up. So for me, I don't, when the patient walks in the door, I try not to, I don't start with Ayurveda. It's something that I gradually introduce to the patient. But I do use it as a lens for myself right away, like I mentioned, in terms of how I may treat that patient. And then once we've sort of established a connection, made sure that some of the basic things are taken care of, I have them fill out an Ayurvedic intake form, which is a very detailed form that sort of asks a number of questions, which helps me sort of diagnose, what exactly their constitution is, and then we sort of go from there. But even like I said, when they walk in the door, the tea that I give, it's cumin, cardamom, cinnamon, fennel, coriander, right? There's no caffeine. It's a great digestive. It helps our liver detoxify, tonifies it. And so I always send them home with a bag of that tea, and I'm like, take it, drink it like it's warm, right? When we're talking about warm,
sure.
nourishing foods. So there's silly things. My kids laugh because I won't have ice. Ice is, very cold, obviously, and it slows down the digestion piece. And so there's basic things that I try to tell my patients. I also don't want to overwhelm, right? We
Hmm.
are in a culture right now where we're told to take 1,000 supplements and do lots of different things like, oh, you should cold plunge. Well, now it's coming out cold plunge is not good for women. Well, we should sauna. How many times should we sauna, right? And so I want to make sure that we keep it very simple. So I call it, life hacks. It's very difficult for me to meditate. I am a perfect, in my constitution is very air movement. I have a lot of looping thoughts. And so meditation is tough for me.
Yeah,
I know it's really important. So I tell my patients, take a candle, light that candle, just stare at the flame and breathe for 4 minutes. It will sort of, kind of we're taking in so much through our eyes. It sort of, cleanses our eyes out. It gives us that moment of reset. And then at the end, I say, just close your eyes and see if you can see that flame. And you do. You've been looking at it for 4 minutes. You've been breathing through it. You close your eyes. You see that flame, and then I'm like, then that's it. Open your eyes, and you're done, right? And so I want these simple things. Nobody has an hour and a half to do yoga and meditation every day. If
yeah.
we did, be amazing, but we just can't climb a mountain and do that. And so that is where I am trying to bring this all, like I said, mainstream and not make it burdensome and not make it cumbersome and not make it not fun, right? I'm trying to change the narrative. Like, this is not a routine, it's a ritual. It's a ritual that you deserve, right? So you're
Yeah.
saying warm, moist foods. It's also about getting the oil back into our bodies. So I tell women, buy sesame oil in the winter, buy coconut oil in the summer, and just before you get in the shower, just sort of rub it all over your body. Just like really rub it in, just take a few minutes before your shower, and that oil will help ground you. It'll help you feel closer to yourself, closer to the earth. And these are just, again, daily rituals versus routines.
Thank you for those really practical things. I love the candle one because so many of us, I don't know what you would call my constitution, but so many of us have that, like, just that it's really hard for us to come down. There's so much going on. We're holding space for a lot of other people and projects. And I love that you gave a very practical example of how to just focus ourselves. And that's one that I'm sure I'm not the only one that will take away. But also things like the sesame and the coconut oil and the shifting of that. Um, it sounds like we can get lots of that. I think we're going to have like some virtual Dr. Singla like workshop or something for those who aren't in Pasadena. But there's lots of things that you're giving us here that I really appreciate. I want to just to better understand what the experience is at Magnolia Center. So people walk in and they're, going through perimenopause. So they've heard of you, they come in and they initially are coming to get HRT, or what is bringing them in the door
Mhm.
before they then discover that you have a community that you offer, that there are these more holistic sort of ways to approach their health. What is the thing that's actually bringing them in the door?
Mhm. Well, I usually get on the call with them for about 15 minutes before they come in, just to sort of level set, talk about what I do, a little bit, and see what their goals are. A lot of times it is just, management of symptoms. I'm not
Mm,
sleeping. I have brain fog. I have night sweats. I'm going to lose my job. I'm going to get divorced, all the things, right? So first and foremost, we have to treat those symptoms. Usually it's with hormone replacement therapy in the beginning. Sometimes even if they are on hormone replacement therapy, again, we might microdose with the GLP-1. We may find other things that we can use. But baseline labs, like I mentioned, they have a female phlebotomist that goes to their home, gets those labs. I get those results. They walk through the door. They have their cup of tea, and then they get on what's called the in-body scale. So it's like a DEXA scan, right? And that gives me a lot of powerful information because it tells me their skeletal muscle versus their visceral fat. And we know that visceral fat is metabolically active. We do not want visceral fat, and
mhm,
visceral fat leads to things like prediabetes, hypercholesterolemia, insulin resistance, all the things that we don't want to happen. And so and we kind of can't tell just by looking at a person. I also want to know how much, muscle that they have, because muscle as we get older is imperative, because muscle is our greatest glucose sink, right? Muscle does great things with glucose. ATP, mitochondria gives us the energy that we need. And so having that baseline really provides us with where we want to go with it. It's no longer the number on the scale, right, as we age. It's really about getting that ratio right. So we have about an hour and a half together where we go over labs, we go
wow.
over the in-body, we go over sort of where they are in their life, what are their goals, how are they feeling? Unfortunately, so many are not feeling well. What are the ways to do that? I like to hormone stack. So I like to start one thing at a time so we know what's working and what's not working. The true definition of personalized care, right, is sort of looking at that person's body. What do they need? How much time do they need? What is it going to take? And so, slow and steady, we make these changes. If you're in perimenopause and menopause, we have some time, right? Um, and then after sort of that hour and a half with me, they end with an Ayurvedic body treatment. I have an Ayurvedic practitioner, midlife practitioner who works with me. And, so they get a personalized sound bath. She goes through the candle gazing with them. She does a poultice treatment where
My
she takes
gosh.
herbs and the oils and kind of goes through, does a massage, kind of gets that oil back in. Because I want to present this to women, right? I want to give them a taste like this is what holistic care looks like, right? And then after that, they start to work with the midlife strength trainer, the nutritionist. They come back and see me. And there's, like I said, the pelvic health part of it with the Emsella chair. I have something called SoftWave, which is an ultrasound machine that kind of just, no
Mm,
downtime, sort of helps with this. I'm really trying. Yes, all the things that happen in our life right now. And then I have a movement studio where we can do small group classes of yoga, do breath work, have community gatherings, and do sound baths.
that's amazing.
Yeah, sound baths. You do not need a bathing suit. People are
No.
like, people have asked me that. I'm like, no.
That's fantastic. That's fantastic. And had I not known better is something I even, like I may have asked that question. Um, that's amazing. I cannot believe you give people an hour and a half of your time. I don't know outside of like giving birth when a doctor has spent that kind of time with me. That's really, truly amazing. And I just think, what a gift to the demographic that serves their population, right? Whether they're serving their homes, their
Mhm.
families, their work, their colleagues, their partners, or whatever, to come in and to be served and to be in a place that's so hospitable and so aware of their needs in advance of them knowing their needs, that those needs are even anticipated. Like, what a gift to give people that that experience and to have created space in service of that. That's really beautiful.
I had a patient who came in last week and she said, I thought I was coming in for weight loss. She
Yeah.
said, I had no idea that I was going to have a spiritual journey and find
Mm.
myself again.
Oh,
I know.
oh my gosh. Oh my gosh. And that makes it all worth it, right?
Hmm. Hmm.
And you can go back and thank your grandma and your mom for the things you
That's
weren't
right.
your 20-year-old self wasn't listening to. You just addressed this particular client who came in last week and said that they were, coming in for weight loss. And earlier you talked about microdosing GLP-1s. Huge, huge, huge topic.
Hmm. Hmm.
I addressed it from the stage at my summit, and it was amazing to me how many people, we had a doctor on the stage and I asked her about it, and how many people came up to me afterwards and was like, oh my gosh, I'm so glad you asked that question. I had that question too, blah, 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 blah. And there's still, it reminds me of what we saw 5-10 years ago with hormone replacement, like
Hmm.
the hushed tones that people
Hmm.
were speaking in. And that same thing is happening with GLP-1s. And I've heard everything from it's a cop out to it saved my life to I'm scared or embarrassed to try it to what does it mean to microdose it when we keep hearing that there are health benefits beyond weight loss? So I've got you here. Can we just talk about this for a minute? What does it actually mean? And let's just be clear that GLP-1s are a hormone. There's something that's in our body. I'm not the doctor, you are.
That's right.
So correct me. But it's something that's happening in our bodies, and we begin to it begins to dwindle at some point. And so that's what we're replacing. Is that how we look at
That's
it?
that's absolutely right. And it in our own bodies it lasts for a very short time, right?
Mm,
So I have to say I have a very strong point of view on this because my point of view has sort of there's been an arc and it's come from here to here. I
hmm
think when we were first seeing Ozempic, I was very worried about the you know rapid weight loss, what that meant, the pancreatitis, sort of the downstream effects, right? Being a clinical researcher, my take is, nothing's for free and medication shouldn't be looked at as just, given to everyone. There are side effects that we need to think about. And so I was concerned about what was happening. What I like about GLP-1s is that we have been using them for over 20 years, right? On diabetic patients, but we have a lot of information on them,
mm,
so that is very helpful, provides a lot of safety for us and guardrails, right? And I think the other thing to think about is sometimes in America, we're go big or go home. And
yeah.
that doesn't necessarily work with medications, right? And so if we think about the definition of personalized care, right, we want a measurable outcome, which for my patients is this decrease inflammation, bringing down their cholesterol, bringing down their hemoglobin A1C, which is a predictor of diabetes, right? And time, right? We have both those things. So microdosing in very small dosages, and when I mean microdosing, I'm talking about like 1 milligram, where the starting dose of Zepbound is 2.5 milligrams. I have seen tremendous results without the side effects, without the nausea, the fatigue, the constipation, the GI effects, right? And so I want people to know that, a lot of times when there's medication, like if you have an infection, you're not going to microdose an antibiotic on it because you don't have the time. You don't want to
Right.
end up in the
Right.
hospital with sepsis, right? But in this situation, we're not in a rush. We have the time. So let's see how your body reacts to it. And that, again, is the thing with women. We are so different. Our biology is so different from one another. Again, how we metabolize, how we absorb. So starting on that low dose, seeing how you're doing, and titrating and adjusting, making sure you're not losing your muscle, using the in-body, you know, machine as a guide. Like, okay, we've lost this much visceral fat. We've maybe lost a couple of pounds of muscle. So we need to sort of rejigger what we're doing with the weight training, maybe the protein. But in most cases, if we're set up, these patients are having tremendous results. They're saying things like, my joints don't hurt anymore. I can wake up in the
Mm,
morning and I can actually work out, because before I'd wake up and everything hurt. It's hard to work out when everything hurts.
sure.
So I think they're a tremendous adjunct to women in midlife, because women will say, I'm doing everything the same and I'm still gaining weight. I'm still seeing my cholesterol rise. I don't know what to do anymore. And I want to tell women, it is this midlife shift. It is this metabolic shift that happens that is just not our fault. And so microdosing these GLP-1s really has been uh, showing to be just incredible. And sort of the synergy of hormone replacement therapy and the microdosing of the
Yeah.
GLP-1s, wow, exponential. It's been really great.
Thank you for saying that, because I have been hearing that. Can you just medically help us understand what are the results that you're seeing when those are worked in, or are taken in concert with one another? Is it quicker weight loss? Is it like, what is it? I'll just ask you.
Yeah. Well, again, there's a lot of times that my patients and I were jumping up and down because we'll get the in-body results, and we'll have the one from 2 months ago, and we'll look at it. We're like, oh my gosh, your visceral fat came down 20%, and your skeletal muscle went up because you've been, doing really heavy weights.
Yeah.
And it's not even like, oh, your weight has gone down,
Okay.
6 pounds, even though it has. The excitement comes from sort of that ratio of seeing that when you see your visceral fat go up and you're like, well, I don't understand, why is that so high? That doesn't make any sense, right? That is very disconcerting for patients. And so when they see that go down and they're like, I've been doing all the things. I think that's the part that I want to drive home, is that what this has done for patients is the motivation. It's the ability to get things done. A patient said to me, I felt really good on hormone replacement therapy when you started me. She was 53 years old. Her doctor told her she didn't need it. And I said, well, that's just not true. Let's go through your symptoms. She needed
Yeah.
it. I mean, not to mention the protection for her brains, her
Yeah.
bones, her heart,
Yeah.
right? But she was symptomatic. So she felt better, and she said, her visceral fat was not coming down. I said, okay, let's start microdosing. We're going to, 1 milligram of Zepbound. And again, she said, I am making all of the right choices now for
Hmm.
myself, right? I'm meal
Hmm.
planning. I'm working out every day. She said the best way to describe myself right now is I feel vibrant.
That's amazing.
53 years old, and she's like, I couldn't get through a cocktail party before without feeling sluggish, without feeling like, I'm just tired, I don't want to be here. I couldn't get through a workout. It just didn't feel like, she wasn't depressed, she just didn't have that sort of that feeling of joy. And
Yeah.
that's what I want patients to get back. I did a talk on Monday night, and I said, these can be the best years of your life. The next day I had someone call, and she said, I just couldn't believe you said that, because my 40s have just been miserable. I've been hit so hard with so many symptoms that I can't imagine aging well, because I'm feeling terrible right now. So the fact that you can say you are in the best years of your life, she was just sort of floored by that. And that's the thing that I want women to know. Yes, yes, it can be the best years of your life. You have to do the work. You have to
Yeah.
put in the time. This is the time. It's going to be, it's never too late, but in terms of your health, it's just so much harder to unwind that, right?
Sure.
When I get my 45-year-old patients versus my 65-year-old patients, yes, we're doing great work at 65, but the difference is at 45, it hasn't quite yet accelerated.
Yeah. It's like compounding interest, right?
Exactly.
So the sooner we start, the better. Thank you for that explanation. And I love the reframe that it wasn't about the scale. It's really about that longevity sort of score that you talked about earlier. Like that's the goal, that this patient could see where she was getting healthier and she was adding meaningful value to her, all of the bottom lines with regard to her health, not just the scale. So thank you for that. Dr. Singla, thank you. Thank you for taking the time to talk with us. Thank you for sharing all that you've dreamt up with the Marigold. Congratulations on seeing it come and be actualized, and hearing people talk about their spiritual experiences and how it's been life changing for them. What a gift! What a gift! And so you've evidenced all the ways that you've liberated others through your work, but I'm really curious, how has this work liberated you?
I wake up every day and I think, I can't believe I get to live this dream, right? If you have a dream for 10 years, and when I say dream, it was a loose dream. It
Yeah.
wasn't something that I was really like, okay, I'm going to do this one day. I'm like, oh, I would really like to. But, 3 kids, I had a job, I had, lots of things going on. So to be able to find this beautiful space, to be able to open it with this vision without a lot of like, not wasn't had a great business plan or anything in mind, and to have patients who walk through the door that I get to help. I mean, it is just incredible. And like you said, in any way that women can in this stage of life, we have so much to offer, right? We have our whole lived experience. And I love that for me, it's all the layers of my whole life. I heard a quote the other day, and it was like, it's really exhausting trying to live inauthentically.
Hmm.
And I think for the first time in my life, I am able to live authentically with all the pieces, with all, I grew up in Middleburg Heights, Ohio. My parents are Indian. My father, worked at Ford Motor Company, but was a Sikh man. We moved to California because it was my dream to live in a place that had diversity and culture and community and abundant sunshine, right? And so to have this piece of my life, you know, actualize is sort of it's incredible. It's beyond belief that I could be here. And so I think that feeling of gratitude really can take us a long way. And I feel lucky that I feel gratitude every day for this opportunity to serve.
Well, I'm so glad you are. I'm so glad you are serving this population, and I'm so glad you spent this time sharing it with us. I know I'm inspired by the work you're doing and finding the ways that I can authentically live in service of others. So thank you for sharing that story. Thank you so much for hanging out with us today.
No, thank you so much for having me. It was so great.
Absolutely, absolutely. And Liberty listeners, thank you guys for hanging out with Dr. Singla and myself. Bye for now.